Hi there and welcome to Dr. G Pediatrics. I am Dr. G. In today's video, I wanted to go ahead and discuss some medications that I recommend packing when you are going on vacation with your little one. So stay tuned for more. Okay, so I am discussing 5 medications that I pack when I'm going on vacation with my children, and they're medications that I would also recommend parents to pack when they are going on vacation as well with their little one, because it's beneficial, it's helpful, and you can just tuck it away. You may not need to use it. I hope you won't need to use it, but just in case, be prepared. Okay, so the first medication that I would recommend packing is a medication in the class of an allergy or an antihistamine medication. So classically, you may think of Benadryl as an allergy or an antihistamine medication, but other medicines considered in that class would be also Claritin, Zyrtec, Allegra, Cyzal. That's just a wonderful medication to keep on hand because it does a lot. There are a lot of different symptoms or things that it can treat while you're on vacation for a child. So if your child, they're in a new environment and they start developing hay fever symptoms, so the sneezy, itchy, watery, runny nose, that can help. Or if you're traveling somewhere and it's like dusty and your child has a dust allergy and they're starting to get symptomatic, that is beneficial or helpful for them. If they have a really bad insect bite, or they've had multiple insect bites and mosquito bites and it's very itchy for them, it can also help with that itching factor or swelling that we can see sometimes with certain type of insect bites. So more so like certain bee stings or fire ants can give a considerable amount of swelling right around the site where the sting happened, and an antihistamine, aka allergy medication, can work to bring that swelling down. And so that would be another indication for it. Or if your child's developed just isolated hives, which can happen to some children. My daughter, when she gets overheated and she gets super hot, she breaks out in hives. And so that's definitely one of the medications that I keep handy. I usually use cetirizine, which the brand name is for Zyrtec for treating hives. So that can also be beneficial for the allergy medication. And then another reason where you may not think about it, but it can be helpful, if your child has really had a severe or considerable sunburn and they have associated swelling of the skin related to the sunburn, an antihistamine or an allergy medication can help with that swelling. So again, very helpful. What a allergy or antihistamine medication will not do, it will not stop an anaphylactic allergic reaction. Let me repeat. A allergy antihistamine medication will not stop a systemic anaphylactic allergic reaction. Okay, that is very important. I have children with food allergies, and that is just a misconception. If your child has a food allergy or a suspected food allergy and they break out with hives alone, yes, an allergy medicine or an antihistamine medication is helpful to help with that symptom alone. But if they are developing additional symptoms, hives plus throat, lip swelling, hives plus throwing up, hives plus cough or wheezing, it's not time to dose allergy medication. It's time to call 911 and or take them to the emergency department. So, because the only thing that will stop a anaphylactic reaction in a child is going to be like an epinephrine, like an EpiPen, Auvi-Q. That is what will help stop an anaphylactic reaction from progression. I know that was a sidebar, but it's very important. Okay, and so within the allergy antihistamine medication, Benadryl is the one that has that's been around for years, but it's considered a first class antihistamine and allergy medication. One, it has a lot more side effects, and two, you have to dose Benadryl a lot more frequently. Three, In some children, Benadryl can give a paradoxical reaction, which means in theory, Benadryl usually makes children drowsy or makes adults drowsy when they take it. Some people have a opposite or paradoxical reaction to Benadryl and get wired. And so for those reasons, I would not recommend packing Benadryl, but I would recommend packing what's considered a second generation antihistamine, such as a Claritin or Zyrtec or Allegra. Those you have to just dose once a day and not as many side effects as Benadryl. Okay, so that's number one medication that I would pack would be an antihistamine / allergy medication. Number two would be a fever reducer / pain reliever, which probably most people pack already. That's kind of a given. But remember, for children, you want to pack either acetaminophen or ibuprofen. Acetaminophen's brand name is Tylenol. The brand name for ibuprofen is either going to be Motrin or Advil, which you don't pack. Well, what you don't pack for children, aspirin. Or if that's all you have in your medicine bag that you pack for vacation, then that means you need to go to the pharmacy, because you do not want to give your child aspirin. Okay, great, wonderful. All right, so number three medication that I pack, that I would recommend packing when going on vacation with your child, is what we call a steroid cream or a steroid ointment. Most commonly, what you can get over the counter is going to be the specific steroid name is hydrocortisone. It comes in a cream form and it comes in an ointment form. Well, who cares? What's the big difference between the cream and the ointment? I will explain. So your cream is going to usually be white in consistency, and it has a little bit more of a not watery, but a thinner consistency. And so think of that, it actually comes on as a lotion. So that's the cream. Nothing wrong with the cream. I mean, if you have, that's what you have, that's what you have. But the ointment is more of in a very thicker, more viscous or thick consistency, almost like a Vaseline or petroleum jelly based. So it kind of stays on the skin a little bit more. It actually provides a little bit of moisturization. It may not make much of a difference in why you're using the hydrocortisone, but say you have a child who's super itchy and they have scratch their skin open from the itching. Sometimes when you apply the hydrocortisone cream, it could burn a little bit more than when you apply the ointment, which has more of that petroleum jelly base to it. So that's the difference between the cream and the ointment. But the reason why I think it's important to pack is because it can deal with a lot of skin rashes. So insect bites, bee stings, anything that's creating that pocket of inflammation or swelling, the steroid is going to be able to help bring that swelling or that inflammation down. Or if your child was exposed to poison ivy or poison oak and they have a super itchy, irritated rash, then that can help. Or if they, on vacation, you guys use the, detergent that the place has, and now your child is breaking out in an irritation from that, then again, the hydrocortisone ointment or cream can be beneficial for that. Or if your child has mild eczema and you just want to pack something quick in a tube, the hydrocortisone can be useful for that as well. And don't be concerned about steroid ointment or cream, because the steroid ointment or cream is the strength of the over-the-counter hydrocortisone that you can buy in the store is considered very low strength. So it's not going to be something that is seeping into the bloodstream and creating a lot of, weird side effects like steroids that you take by mouth can. So don't be worried about that. You can, safely use the hydrocortisone ointment or cream as needed for your child in case they have any type of skin conditions that may pop up during vacation. Number 4 is another skin cream that you can use, or I would recommend packing, is a antibiotic ointment. So like a triple antibiotic or like a bacitracin, you can get from the pharmacy without needing a prescription. I would recommend keeping handy in case your child has a cut or a scrape or an infected bug bite. You can start applying that, or if they stub their toe and you're afraid about it getting infected, that antibiotic ointment or cream would be definitely recommended. And then number 5 would be just kind of something to help with like the tummy stuff. So an antacid, I would say I like, and I'm not sponsored, but for example, Pepto-Bismol makes a children's chewable approved for ages 2 and above. And that is going to help maybe like if they have a sour stomach, or they have indigestion, or they have heartburn, or they just feel a little bit queasy while they're on vacation. That is a good thing to just be able to keep handy to give in case they have any of those stomach issues while on vacation. The Pepto-Bismol chewables does nothing for diarrhea, so that's not something that's going to really help with diarrhea. Furthermore, if your child has diarrhea, most likely if we think it's infectious, we do not recommend using an anti-diarrheal agent such as loperamide or kaopectate for stopping that, because we want whatever is in your child's system to be flushed out. So that wouldn't be something that we would recommend anyway. So again, the 5 medications that I pack when I'm going on vacation is a allergy / antihistamine, a fever reducer or pain reliever, a topical or skin steroid cream or ointment, an antibiotic cream or ointment, and also an antacid that is approved for children. If you have room and you want a bonus thing that you could pack, I think nasal saline spray is great. You can use that in infants, you can use that all the way in teenagers. In case they're just stuffy or they're irritated, nasal saline can help just moisturize the inside of the nose. If you have a child who's prone to nosebleeds, if they get super hot or super cold, nasal saline spray can help moisturize the inside of the nose as well. So nasal saline spray would be a bonus if you have room, and a thermometer, because that's not really a medicine, but I think you should pack a thermometer and Band-Aids. I think I'm an overpacker. I hope you found this video useful or helpful. Much love to my sister who asked the question, which prompted this video. If you found it helpful, please subscribe, or if you think anybody else that's going on vacation with their children would find this useful, please share. Until next time, have a wonderful day. Bye.